Yeah. So, A'udhu Billahi Minash Shaitanir Rajeem, Bismillahir Rahmanir Rahim. As you know, at VOTP, we carry out a number of talks educating our audiences on different areas. So, today we have a very special guest with us on an area that is very dear to our heart. As most of you know, who are with me on the relationship building course, we this Thursday asked the question, who should I have the closest relationship with in my life? And we answered this question by saying, who shares the same life goals as yours? Who will you spend the most of your adult life with? Who will witness most of what happens to you in adult life? Who will be with you in times of loss and in times of happiness? Who plans to share the same space as you through their lives? And that is your spouse. We're looking at people, it is a spouse. It's a very sacred relationship. And we want to strengthen that relationship. There's a lot that is going out on it in current times. New ideas are coming through social media. It is basically the foundation, it rocks our foundation of society if we don't keep that bond of family together. So today we have with us a very special guest, Dr. Rahil Sikandar. She is a retired professor of obstetrics and gynecology. She's experienced in her field for the last 30 years. She's been practicing. Even now, she deals with patients 40 a day. So she's very familiar with the area, and her approach is very holistic. So in that sense, we want to open the floor to you so that you, without reservation, can ask questions. It's a very frank communication that Dr. Rahil will tell you about. It is necessary. We should know about our bodies. They go through changes. Both the man and the woman, both should know about them. And if we don't know about them, from a Muslim perspective, then any knowledge can replace that. And we go on the wrong way. So with that in mind, I would ask you to please write down your questions as Dr. Rahil speaks, and we will give you the floor to ask your questions from her after her talk. So over to you, Dr. Rahil. I will put your presentation on, inshallah.
Okay.
Yeah. Let's see. Tell me if you can see it.
Yeah, I can see it.
Yeah, Alhamdulillah. Let's begin. Over to you.
But this is the last slide, I think.
Let's see. How are we doing now?
Yeah.
Oh, Bismillah.
Bismillahirrahmanirrahim. First of all, I would like to thank you for inviting me on this forum. And I will be happy to share the scientific reality of natural physical phenomena and the interactions. So to begin with, let's start with the first model that Allah subhanahu wa ta'ala has shown to us. And this was, all of us know as Muslims, this was what was given in the Holy Quran. This presentation is blocked by the screens. These, how do I remove these? So then I can't read it.
So you can't read the screen?
Yeah, because these our screens, our videos are coming there. Anyway, I can start.
You have
So
your own PDF, right? You have your own PDF.
yes, I do. I can read it from there.
Yeah,
That okay.
Hmm.
So so let's begin. The first model that Allah Subhanahu wa Taala has given to us, and it was in Quran, that Hazrat Adam alayhi salam was in the Jannah, and his need for Sakinah was acknowledged by Allah subhanahu wa ta'ala, and Hawa alayhi salam was created and sit beside him, establishing a emotional relation. And just give me a minute so that I can open my PDF. Right. So when Allah Ta'ala acknowledged, and one day when Hazrat Adam woke and he saw that Hazrat Hawa is sitting beside him, he felt inclined and felt peace in her company, and there began the first union, right? And then all humanity descends from this first sacred union. There was a peace and joy that was felt by Adam alayhi salam in this union. The earthy reflection we see in our traditional model, when a boy reaches puberty, he is decorated as a groom and supported by the elders. And one day, behind closed doors, finds a woman decorated, wrapped in fragrance, sitting beside him as his bride. The couple explores and consummate and learn the intimate dynamics to establish the home as true sanctuary and find their Sakinah. To understand the body's sacred design, we know that physical exploration leads to arousal and flow of secretions which are specifically within the genitals. This biological design points to intended site for sexual union. The body's design confirms that the anus and mouth are not physiological sites for sexual intercourse. Intimacy must adhere to the limits by the fitrat, the Islamic law ensuring health, purity, and the sacredness. The physical design of the body provides the natural and halal permissible boundaries for intimacy in the Muslim marriage. When this connection starts, the early physical intimacy is the catalyst for the deeper connection later on. It leads directly to profound emotional and spiritual intimacy. The couple grows together, supported by family, transforming the home into a true sanctuary for the closeness. If we look into the hormonal responses, then it is being taught that whenever there is an exposure to the potential mate or a social challenge, it elicits an acute and transient increase in the testosterone in the males across these species. So this will happen in human and even animals as well. But the hormonal balance is directly modified by social experiences, including dominance and stresses. The marital connection is designed to harmonize these hormones, moving them towards the stability and health. A wide range of better psychological and physiological health indices are specifically associated with this penile vaginal intercourse, and these are proven by many scientific studies. Other sexual activities showed weaker, no, or inverse association with health indices. So these activities could be masturbation and anal intercourse. Scientific findings affirm the unique health benefit of marital act as defined by the body's natural design. So that's how we are being formed, and this is our fitra. So that's how the science also supports this. This this connection or this nearness leads to reduced blood pressure, lower cardiovascular risk. It boosts the immune system and strengthens body's natural defenses. It relieves pain and act as a natural analgesic and tension reliever. There is a good sleep, relaxation, and improves the strength of pelvic floor muscle in the females. In some studies, it also says that frequency of the penile vaginal intercourse saves men from the prostatic cancers. Mental and emotional health, if we talk about, then the Sakinah is found in that. There are significantly lower stress and anxiety levels in this natural bond between men and women. It fosters profound intimacy and emotional closeness with your spouse. It contributes to improved self worth and confidence, acts as powerful natural defense against the risk of depression. And many scientific studies also proves that. Now, how this begins? It begins with puberty. What happens as the girls gets mature, their ovaries start functioning. Estrogen and progesterone are the female hormones that are produced from our ovaries, and they give rise to not only to the menstruation and other physiological secretion produced in the female genital tract, but it also gives the contour to the female body. Whereas in the male, at around this age, when they are getting towards the adulthood and adolescent, the testosterone surges are there in the males, and this sometimes lead to their ejaculations during night as well. So all these three hormones tells us that as a physical body, now this young child is getting mature and is able to reproduce. As a result of these unions, the love hormone, that is oxytocin, it is also produced, and the physical intimacy can lead to a more multidimensional intimacy. And as a reward of this physical union, the dopamine is also released, giving you a happy and satisfying soul. So the neurophysical changes are telling us that now this child is getting towards the reproductive maturity, and at the same time, the sexual awareness also start in that person. The crucial question at this time is, are these young uh, adults or the adolescents, are they mature enough to start a mindful and meaningful union? And what do we mean by maturity or the meaningful union? Maturity means the how conscious we are of our creator. Do we know that we are not only physical being, but we also have a spirit? So that holistic understanding of a person, when it comes to you, then this means that you are a mature person. The requirements for a meaningful bond are that there is bonding and trust. It means that you can't live without each other, and you trust and you can share your very secrets to this person. There is mental intimacy, there is spiritual intimacy, and emotional and intellectual intimacy as well in a meaningful bond. But the crisis is that the trends are very different from whatever we have learned now. The statistics shows that 50% of the American adolescents are engaged in some form of sexual activity. And the landscape is shifting, that they are the men, they or the boys, they are there is a decline in the penile vaginal intercourse, but there is no decline in the overall sexual engagement. This means they are going towards the non-fitra kind of sexual experiences. So this trend of this society is against the young marriages, pushing couples towards long term premarital cohabitation and delayed commitments. So how the secular world respond to it? They came up with the solution that contraception is deemed necessary to manage the risk of unwanted young age pregnancies. The link that was missing was that this framework addresses only the physical consequences, that is, they think is pregnancy, but it ignores the emotional, spiritual, and psychological damage caused by premature or unprotected intimacy. Or rather, we should say undisciplined intimacy or unmindful intimacy. The focus shift from fostering a healing bond within a sacred contract to merely managing the risk outside of it. And all these things lead to problems, the one of which is sexual dysfunction. Now, the sexual dysfunction that we clinicians do see come across is the problem that prevent a couple from experiencing mutual satisfaction from the sexual activity. The alternatives are available in the form of pornography, visual arousal. This is unequivocally not allowed in our faith. Masturbation. This present a complex fiqhi dilemma. There is one view saying that it as a lesser evil to prevent the individual from committing a major sin, often seen as a logical stance in the present time, and many of the scholars have ijma on that. The other view is that this is totally forbidden, and it is haram. Whatever it is, the principle should be that regardless of the ruling, one should always remember that excess is always harmful. But this leaves us with a central question. How would Muslim youth face this situation to maintain the fitra and achieve Sakinah? Keep this question in your mind, and let's see what the sexual dysfunction and what is the root cause of this. In a capitalist society, the problem begins when where the career, profits, status are prioritized. Result is that these pressures delay marriage among the young people, leaving the youth in a state of extended sexual tension. If we look at the West, then statistics from the USA are that 75% of the boys or girls had at least one sexual intercourse by the age of 15. This indicates an enormous amount of sexual stress being released outside the marriage. And if we look at the prevalence of the sexual dysfunction, then it is present in 43% of females, whereas the 31% of the male are affected by it. These physical dysfunction could be related to physical pain, not only during the particular periods of life in a female, but this delays the consummation of the marriage also because of fear or a condition which is called vaginismus. A couple is unable to consume their marriage. There are desire issues and there are arousal problems. In case of male, there are erectile dysfunctions, premature or delayed ejaculation, or there is a low desire. Now, one of the reasons for these dysfunction in married couple is their indulgence in other sexual activities before marriage, and later on they are unable to attain the maximum sexual satisfaction from their spouse. These alternative acts are not only less satisfying but later result in clinical issues which are listed above. The damage done by deviation leads directly to marital disharmony, providing that sacred design is essential for lasting connection. Now, the challenges challenges to especially the Muslim families and what should be the Muslim response to it. The ideal solution should have been early marriage, but it is often not feasible in the current socio-economic climate. We must learn how to live purely while waiting for the feasibility of the marriage. So, to achieve this, one should first of all have a self mastery. And the three pillars of the self mastery could be that one should elevate one's value, know that you are the best of creation and deeply loved by Allah subhanahu wa ta'ala. Live a life that rises above the mere pleasure seeking and animalistic survival. Save yourself only for your partner and remember that Allah's promise is Allah loves those who hold themselves and open their private parts only to their spouses. You have a mindful life with a purpose that is bigger than just survival, which is the purpose of a unicellular organism like amoeba, or a pleasure seeking way, which is a way of life of animals. They need pleasure wherever and whenever and however. Or passion, which is the present time pressure over our youth, that there are material goals, the career, the status, or all these things. So when you are living for these purposes, there is a problem in the self mastery. If the purpose is bigger, the purpose is that you should know your destiny, which is that you are the one who will live in the gardens of heaven because you are pure, driven by love and peace for your family, community, and the whole world. The correlation, if we correlate the intimacy and see why it matters, then the findings in the literature are that specifically penile vaginal intercourse frequency and vaginal orgasm consistency are associated with indices like greater intimate relationship adjustment, higher marital satisfaction, improved compatibility for both the partners, and this has been given in the scientific literature. There is an inverse relationship when women's masturbation was found to be independently and inversely associated with the measure of dyadic and personal function. Male sexual disturbances not only affect reproduction, but significantly impacts the couple's pleasure and deep emotional bonding. Sexual function is not merely a physical act. It is a powerful predictor of marital harmony and deep emotional connection. Dysfunction damages the healing bond. Intimacy is built up over time and it is not instantaneous. It requires consistent patience and effort from both the partners to create and sustain this rewarding connection. Its dimension could be emotional, sexual, intellectual, recreational, financial, spiritual, creative, and crisis management. So, intimacy covers almost all the requirements of the human existence. In the end, I would like to give take-home message that to reach such an intimate relationships, to give our youth purpose in this intimacy, we as parents should feel responsible that sexual maturity is the nature's work. When the puberty comes, the hormones are there, and your child or the young adult is mature enough to reproduce or have a sexual connection. But as parents, our primary duty is to nurture the intellectual and emotional maturity. The intellectual maturity, as we have already discussed, is Allah consciousness, that is taqwa. So, if our child has reached this level of maturity along with the physical maturity, and they demonstrate this in front of us, then as parents, we need not to object to their decision to marry simply for the sake of objection, and we should support the halal solution. To look at from the youth's perspective, they really face immense pressure from not only the hormonal surges, and they are now in a highly provoking society, the media, the drugs, and the explicit industry. If marriage is not feasible, release sexual stress through whatever is allowed in your faith. But the rule should remain, then do not get addicted. It is only to save you from a bigger sin. Your future is created by your single step, which is in the right direction, your commitment to purity and the purpose. And this will unlock the door for future health, marital harmony, successful life in this world, and eternal bliss in hereafter. Jazakallah khairan kasira.
Thank you,
This is
Dr.
all from my side. Thank you.
Thank you, Dr. Rahil. I think it was very informative. The audience will agree with me. Please show, how did you find it? We are welcoming all questions that you have. I'm going to put up a survey form as well for you to answer. So please have your questions ready. There was a question in the chat, right? Do we have any more questions? You can put them in the chat. I'm going to take up the first question that was there, but please give me a few minutes also to put the survey form. So,
Okay.
our first question to you, Dr. Rahil. I have a question. This is from Sister Aisha. Is Sakinah only physical connection? What about spiritual connection?
Yeah, I think this is what we explained that in as we talked about the marital harmony, and in the traditional model, usually there is the boy and the girls, they don't know each other, right? Or they might be knowing each other, but the first they start with definitely a physical intimacy, because as per religion they need not to be in lot of discussions regarding these other things. The main discussion that they are going to do is after they get married, right? This is what our framework, the Islamic framework, is. So when they are connected, and as the physiological response was, so they might be having a physical intimacy, and that will initiate the spiritual intimacy, inshallah ta'ala, as it is given to us in the divine model. So to begin with, the spiritual intimacy can be increased or enhanced by the physical intimacy if we are working in the framework given to us by our faith.
Thank you, Dr. Rahil. There's another question. being asked. I have a question that if I want to marry earlier, what should I start preparing for? What steps should I take spiritually, emotionally, in career, and practically? In today's society, the focus is heavily placed on financial stability, a secure career, owning a home, and material achievements. What if someone doesn't have all of that yet?
Yeah, this is the challenge actually. And the whole society, it's not the one person who can solve this issue. Na? You need to have supportive parents and the society that will support you. So I have seen this in the not this Jamaat Islami, but there are other religious parties or Jamaat who do facilitate this. If somebody goes to them, then they arrange these kind of marriages, and then they help them also financially. They find some solution to these, but this is really a challenge until and unless the whole society or the family or the parents are not ready for it, so it is going to be very difficult.
Hmm. So basically, we are talking about building our communities to be very
Yeah,
supportive
yeah,
in this area so that the child, when they feel ready and they're intellectually ready, spiritually ready, they have taqwa, we can support them financially. It's such a big issue.
yeah, yeah.
Is that what we are saying? Yeah. Okay.
And you see, it's not only the this relation that in which we have to follow our faith. Our faith also tell us to live with modesty, but with this materialistic kind of lifestyle that we are having, this that modesty is lacking, and that's how we are having a lot of material pressure on us. We need to build a big house in a good colony and all the material things into it. So we have left that modesty also. So
Mm.
it's a whole framework. It's not only one thing that we can just start with, no?
Yeah. It's so
Mm.
true.
That's the parents' responsibility to make their lifestyle like that. They can't live a very lavish life and ask their child to follow the framework. They have to be the models.
They have to exemplify it themselves.
Ah, yeah.
Yeah, exactly. Okay. And also, for those of you who are new to our platform, we are providing the training on this area to grow spiritually. So please reach out to us, join the platform, and you can learn
And
about parts
if
of.
you allow me, let me quote the example in my field. Uh, the tragedy is that our students are following us when they look that the professors, they are having big cars, they are living a very lavish lifestyle. This is what they are concentrating. They don't concentrate on giving the care. So they make their goal of achieving the success that we are having. This is what I'm promoting in my field, that we as the seniors, as the teachers, need to reduce our mm, status of living, you can say, or simplify it and make it a more natural living style rather than the very lavish kind of style. Only then we can introduce this in our younger generation.
Yeah, it's true. Setting example is the main thing because children learn from parents and see
Yeah.
what they see in the homes.
Mm.
Um, So there was a question about boys and the age of marriage. What is the right age of boys to get married? Because if they say, I'm not ready until 23, then what should we do? Some are not even ready till later, 23
Yeah.
is getting to be
Yeah.
early now.
No, if they say they are not ready, but and they are within the framework of our faith, then it's okay. You can't push them to start it. Yes.
You
If
can't
they
tell
are
them.
not ready,
Yeah.
fine, but you are mature enough, you are Allah conscious, you know what are your limits, then fair enough. Then it's fair. You can handle your physical needs within the framework of your faith, then this is fine.
Okay, that's good. All right. Any other questions? Please, you can, ask the question yourself as well. Raise your hand, open the mic, or you can put it in the chat as you like.
You see, when we say be Allah conscious, it means we will be conscious of the people who are being loved by Allah, as in Surah Fatiha, there are people whom Allah Ta'ala has His blessings, right? An'amta alayhim, right? So this boy can look into the lives of those who were the An'amta alayhim, and what did they do when did they get married at early age or not? Or matlab, the examples are there. Examples are definitely there.
There's a question I once heard a scholar say, when done with sincerity, nikah doesn't bring more problems. It begins to solve them. Means every problem will solve. Is it truly real?
Nikah not solve every problem, but it's you who are going to solve the problems, right? Nikah will start intimacy if you want to. And then all the dimension of intimacy, if you can get, then as we have said, that the dimensions of intimacy were even the financial, the recreational, the crisis management, then yes, it is going to solve the problems.
Good. So another question we have is, how much intimacy is safe? How much intimacy is safe in married couple? Can you expand on that question? What do you mean by how
Yeah.
much? Could you expand on that? Is it Sister Shema? Is that you who's asked this question? How much intimacy is
There
safe?
was one reference.
Some men want intimacy every day, others even once a month. What is the acceptable level of intimacy that would be fair to expect?
See, this, when we say intimacy, it means that both of them will decide that. Both are knowing each other's wants and difficulties. Intimacy doesn't mean just come and enter. This is not intimacy. Intimacy is that you both are bonded with each other, you know, and you see, Allah subhanahu wa ta'ala has given us the women the periods. So this means those 5 7 days there will be no physical or you can say the penetration into intercourse, but physical intimacy otherwise is allowed. So there is even science doesn't stop you from having it daily or day after or whatever. This is very, very intimate question actually between the two people. It's they who will decide.
Yeah. So they get to know each other and they see what they
Yeah.
like and how they prefer it, and both caring for each other. It's basically about caring for the partner, isn't it, Dr. Eva?
Exactly. And only then we call it intimacy. Otherwise, it's just a physical act,
Mm-hmm.
right?
Yeah. Yeah, I understand. Okay,
May I read another question from the chat?
sure.
What
Yes.
is the right age for boys to get married? Because if they say I'm not ready until 23, then what should we do as parents?
Yeah, I think we did that one, Safia. We
They
just did,
did?
we covered that one.
Okay.
Oh, yeah. Any other
See,
questions?
we should respect our children, right? If somebody is saying I'm not ready, then we can sit with him and ask, what do you mean by you are not ready? Why you feel you are not ready? In the old days, when young children used to go with their father to the mosque or to other places where the elders are gathering, they were not actually teaching the young child what is right or wrong in that particular time, but the issues that the elders were talking with each other or with the imam or with the other, there used to be the sexual issues as well. And that young boy who is sitting with his father listen to those, and he then understands what is the our Islamic framework for these kind of things. And that's how they grew. There was no sex education at that time, but they were knowing what is right and wrong, right? So this kind of thing is it is the missing link which nowadays we are facing.
Sister Shaldia is asking also, how about boys of 19 or 20? If you think they are not intellectually mature enough, but they want to get married, then what should you do?
Tell them that you are not mature. Yeah.
Hmm. You need to be more mature in order to take
See, before,
responsibility for another partner.
yeah.
Hmm.
See, before there is a bond between a man and women, there has to be a bond between a parent and child.
Hmm.
So as a parent, if we are bonded with our children, then we can answer their questions and we can tell them, okay, what is the right time or not the right time.
Yeah, that's a very important area. It's the bonding
Yeah,
that needs to develop. And when it's missing, then somebody else replaces that bond and the
definitely,
questions.
definitely.
Yeah, and they get answered differently. Sister Aisha, you got a question there. I haven't read it because I don't understand that word that you put there, last. What is it that you're trying to say? Promise of a last. What is the word you want?
Yes, this is the Vadai Alas, which is our purpose as a human being, which is
Hmm.
mentioned in the Quran. So,
Promise
in the
of,
light of that, yes, the
okay.
Vadai Alas, in the light of that, how do
Hmm.
we see a couple? Like, how can they strengthen their spiritual connection more?
So you're
Right.
talking in the hereafter, I mean spiritual connection in the light of the promise of the hereafter. We can't achieve our purpose if spiritually the couple isn't working as one. That's the question of Sister Aisha.
N- no, I got confused. What is the question? Please, can you
Question
repeat it?
is, the question is, how can we achieve the purpose spiritually when the
Yes.
purpose is to,
Question.
gain the
Ibadatullah.
hereafter,
Yes.
gain the place in the hereafter, if the couple isn't working as one or towards that goal. Have I got it right, Sister Aisha?
Yes.
Okay.
Well, these questions are actually do not belong to my field. These are the question for the family counselors and the psychologists who will tell you how to work as a in a healthy couple. But when I've read it, as far as I would like to, it's just my opinion, right? It may be wrong. What I think is when you are mature and you start, this means that you are Allah conscious, right? This gives you taqwa. And in a relationship, both the spouses need to be mature when they are starting the relationship. So when they are both are Allah conscious, whatever they do is with that consciousness and with the taqwa, then usually barakah comes. Then usually the things that are being done, although the worldly things, but they will be rewarded from Allah subhanahu wa ta'ala, and they are taken as ibadat. It's not only the prayer which you are doing on the prayer mat that is a prayer. It is your whole lifestyle become a prayer, which we are supposed to do, which is the purpose. And if we are doing it with Allah consciousness, both of the couple spouses, then the solutions will come. And for the problems, the thing that is given to us is dua. They work together in one direction, and if they are not achieving what they want, they ask from Allah subhanahu wa ta'ala, who always guide. Allah is always guiding you, but the thing is that we are asking it from Him, and asking with sincerity. We are doing whatever we are doing is with very sincerity and very God consciousness. But I'm not a scholar in that field, right?
Yeah, I got it, Dr. Rahel. I think, Sister Aisha, we're also looking at the relationship course. You know, we don't have two partners always the same. One could be materialistic and one could be spiritual. Allah Ta'ala makes the union. Allah Ta'ala makes this union. And it's got its benefits. We
Yeah.
complement each other. You know, everybody doesn't have to be the same high spiritual to get married. You know, otherwise then people who are not spiritual would never get, you know, they'd always find a non-spiritual partner. Okay, one is spiritual, one is not spiritual. You both help each other. So I would definitely say, look at the relationship course that we are running, and inshallah, you know, you'll help each other. You know, whatever the husband is, he's got a lot to offer. Even if he's not spiritual, he still offers a lot to you, and you offer a lot to him, and together then you start rising spiritually, inshallah. Yeah. Sister Aisha, is that good? Okay. Any other questions anybody would like to ask? We got
Assalamu alaikum.
one. Sister Aisha, go ahead.
Can you recommend any book like in the light of Islam we can read like related to that?
Related to what?
The whole rights and stuff.
Yeah, if you study the lives of Sahaba and these Azwaj Mutahharat, Ashaba Karam, then you will get all what you can see everything in their lives, and you can get help from it.
Oh, okay. I think I have been studying them. I
Yeah.
was like looking for a like particular book. If you like taking reference from them, it's all right. Yeah.
Okay.
I think she meant scientifically,
Yeah.
right?
You mean scientific?
Like this
If
whole
you
science of relationship, then that's what I think she meant.
Yeah, okay. Then I think there are references that I have quoted. These are the articles, and there was a very good study done in Karachi about the young girls and boys and their sexual tensions. There are references. So I can send these articles if you haven't seen in this presentation. There were references. There are
I was
Pakistani
asking for
references as well.
study purposes so I can learn more. It's all right.
Okay.
Mm.
Another question, Dr. Rahel. I've seen most of women repulsed from marriage because of fear of bad partner, abuse, and so don't want to marry. So what should we do if the girl is so scared of a bad partner and then she doesn't have any way out?
actually these are the social problems. These are not medical problems,
Mm,
right?
mm.
And it's not the girl only who, I don't know what is over there, but here usually it's the whole family that will find some suitable partner for her. So, and there are also the matchmakers, and there are the counselors who will help you in reducing this fear.
Yeah.
So
I
I
think
think
that's
these
also
are the
to stand by daughters who are being abused, Sometimes it happens that there's so much parental pressure to make everything right where you're married and go and make it right, whatever it is, that the girl suffers on account of that. And the parent and in-laws need to be looking at the right kind of treatment. They need to stand up for what is right. What do you think, Dr. Rao? There is a role to play.
Yeah, all these are the social problems,
Yeah.
no? These
Yeah.
are as a community, we should be helping these families, these girls.
Yeah, that's true. That's true.
There's nothing medical. Hmm.
So a medical question, doctor. Um,
Mm.
I have like numerous women, and like I would say early to late 30s, not even 40s, and they said they don't enjoy the the intimacy anymore. Um,
Yep.
and the simple excuse is like, oh, my kids are grown up, and they don't understand that medically there's something wrong going on. So how do I explain them, and how do I make them realize that go get hormonal testing, and get the nutritional testing and fix your diet and stuff? What is the scientific way to convince them?
Yeah. Uh, I'll tell you what I do with these women.
Thank you.
I usually first tell them to understand that the age you are passing through, usually it starts in late 40s, but if it has because of multiple stresses nowadays, we are seeing that this is coming in the young girls as well. So these are the changes that your body is having. So this is possible. The first thing is to understand their perspective and empathize with them, right? And then make them understand that their husbands, what are their husbands' needs and what the intimacy means. It's not the testing that always tell you. In early 30s, rarely you will find any hormonal deficiencies. But now they are giving the testosterone patches to increase their desire for intimacy or accepting that. But as I
Okay.
said, see, the first thing is that you should be very Allah conscious. And I usually ask my patients, that, do you then want to have another? Islam has given this allowance to the men to marry another woman if you are not
Hmm.
fulfilling this. So, okay,
Hmm.
because this is his need and you love him and you understand his needs, but you are, then most of them are convinced and they can have this testosterone patch. And the other thing is to tell them, let it go. So what? If the children are grown, that's okay. They should also know what is the natural cycle of the life.
They should know that mommy and daddy are in love, and that's how a healthy
Yeah,
relationship
yeah,
is. So they get the good
yeah,
base.
yeah. Why
So,
not? Yeah.
in the same light, what about when a woman has desire and the man turns away?
This,
Is there a way to bring it to men's attention that, hey, go get your testosterone checked up? Is there a polite way to say that?
yes, yes.
Thank you.
Again, you see, the counselors are needed. right? When these are the
Okay.
problems, they are coming up with these problems. And let me give you an example of a patient. She was in her 50s and a widow. And she said, I'm having this desire and I don't know what to do with it. And
Oh,
she has adult sons, and she said, I can't control it. So then in these, there are some very difficult cases as well. And sometimes she was given some medicine by the psychiatrist later on, and that improved her. But these things happen. Yeah. So they need counselor, and there are psychologists who help them. And similarly, if you ask the couple to you and ask them how you are making your wife happy, is she satisfied? Have you asked this question to your wife? Are you happy with me or not? Matlab,
I
see, the
doubt it.
intimacy is not only physical, it is that they are mentally also connected and they are open to each other and they can trust each other. है ना? So that thing is lacking in our women. We either women are shy and we don't raise our daughters in this way that they can also ask. But I think the young people, they are pretty open than the older generation.
Right. So, another category of patients, of people that I see, and they ask me, I don't know why, that, and they're all very young, like early to mid 20s, late 20s to mid
Mm-hmm.
30s. They have a problem that they like to eat, and that gives them pleasure rather than go to bed. Um, I mean, is that
It,
like is that not medical issue? Because they get their dopamine from food and not with the intimacy. Is that a
that
medical
is
issue?
It is, you can say, a psychosexual dysfunction, na? And that is being
Psychosexual.
treated. And yes, there are now specialists for these sexual dysfunctions. This is a full separate field. So if there
Okay.
are serious problems which you cannot overcome simply by just simple counseling, then they are being
Hmm.
referred to those specialists and they do treat them. But most of the time, it's usually the counseling, because eating more again is in up to the limit of addiction is
Hmm.
an issue, is definitely an issue.
So getting pleasure from food is unnatural, and that's an addiction, and they need to come out of that addiction.
If it has become an addiction, then yes, they have to come out.
Okay. So it's probably mostly holding the grudge, and that's why they're not getting to bed. And then, well, a person won't go to bed. What other place you have is the kitchen. So pleasure seeking either way, pleasure from
A
food.
person,
Okay.
a person in a relationship, you mean to
Yeah.
say a person
Married.
in a relationship?
Yeah.
Yeah,
A married woman enjoys
definitely.
eating and rather than going to bed, even when her husband calls her for an
Yeah,
intimacy to
so
play, she rather go eat something and get her fix, like dope fix, you know.
there is definitely a relationship problem which they need to have resolved.
And they're so very young. I mean, I'm okay if somebody after 50 say that to me,
Yeah,
but late 20s and early 30s, it,
yes,
I
yes.
sometimes I get puzzled, like how do I solve that?
Definitely the psychologist is going to help them out. And or the marital counselors. We need to
Hmm.
dig into and find out why she is not getting pleasure from at this young age. Physical intimacy gives the most pleasure.
Right. And that's natural. And food is
Yeah.
unnatural.
Exactly, exactly. So there is definitely some problem, deep-rooted problem, which the psychologist or the counselor need to dig out and then treat that.
So now medically everything is fine, and like another situation, and they love each other, and she even likes him to be around. Um, but she just doesn't do it, or I don't know. Maybe playing is like reward and punishment type thing, that our society does, mostly women, because they can control it. Um, how do how do we convince them scientifically, medically, that they are also missing out if they're holding on to that, to not being intimate? Like they're not just punishing their husband, it's their bodily need too. How do we medically explain it to them? Like I'm trying to ask, I'm not sure if I'm able to reach you.
No, definitely. This is a highly specialized field.
Mm.
There are specialists who can help them, who will find it out. It's not by see, I'm a general gynecologist, so I will only have to first detect that there is a issue, and then I would like to refer them to some dysfunction specialist where they can get it. Because there are, yes, you are so very right. I have seen a couple, and they had a love marriage, and then the boy said, I love her so much that I cannot get to do this. I'm so afraid. And the girl got frustrated.
Mm.
And then we sent them to a psychologist, and they helped them. And now they are having kids. So
Well, but when women, it's not. I don't think it's a psychology. I just need some science behind it. When women in a society, in our society, use sexual intimacy as a reward or punishment, she's missing out herself. That's the point I need women to realize. That if she's holding grudge and not going to bed and being intimate with her husband, she is missing out. And how do we explain that missing out factor in scientific manner, that the intercourse and play around, and what benefits she's missing out on?
There was a whole set of health benefits after this sexual intercourse, and that was their cardiovascular health improves, their sleep improves, and you can say if you sleep better, your skin will be beautiful. So yeah, yeah.
You
The,
you
this
you hit the nail on the head. Brain
these are the
fog?
scientific facts. I think there was a slide showing you the health
Screen
benefit.
number 5,
This
Dr. N.
prevents
Screen number 5.
infections in your body. This improves your immune system. So there are a lot of benefit, and it particularly said there was I think reference also that the frequency of penile vaginal intercourse and consistency lead to these benefits to both the partners.
Not just one time, once a year. Okay. Consistency and okay.
Consistency
Um,
and frequency.
s- so once you mentioned during your lecture, you said um the intercourse prevents men's prostate issues. Is that
I said there is one
scientifically correct?
study,
So,
not lot many
so
studies, but few. Hmm.
right, no, that's that's a microbiome, Lactobacillus reuteri, that Dr. William Davis is researching on, and I've
Mhm.
read about it. So,
Mhm.
but so on the other hand, what is it that the vagina benefit for of the intercourse? Like in the same realm. I- is there any benefit to our uterus or the pH balance of vagina? Because most women are afraid because every time they go through intercourse, um, they
They
get
have infection or
urinary
itching.
tract infection. I was
Mhm.
like,
Mhm.
and they're just afraid to do. So how do we, I
It's
mean,
not
like,
because
yeah,
of the this intercourse, but actually it's the patient. She need to be looked as a whole. If she has another comorbidity or any other issues, only then she has it. Otherwise, if you continue having vaginal intercourse, then because of the oxytocin release and because of the contraction of the smooth muscle, the health of the vagina stays healthy up to a longer time in your even when you are aging. There are rugies in the vaginal wall that get disappear as the estrogen levels reduce. But if they continue having vaginal intercourse regularly, then they can have penetrated sex even up to 65, 70. And this does help the vaginal epithelium.
the skin benefit was epic. Thank you. I'll use that.
That has a
Thank you very
relation
much.
with sleep, isn't it?
Thank you. I appreciate your help.
You're welcome. You're welcome.
Jazakallah khair. Any more questions, or should we close down? We are calling Dr. Rahil for another talk very soon, in about 4 weeks' time. And we'll have a different topic, but I would really, really appreciate it if you fill in the survey forms, because then it also helps us to include questions that did not get answered, and Dr. Rahil can cover those as well. So please do take the time to fill in the survey form. If there aren't any other questions, then we will close down. Is that okay? We're all done? Yeah? Okay. So thank you so much, Dr. Rahil. We are very appreciative of your time. I know you're very busy. Even today you were attending a seminar, and so I appreciate your dedication to coming here and talking to us, and also willingness to continue to educate us on this very important area. So Jazakallah khair, and I hope everybody benefited from it, and we pray and thank you for your valuable time given to us today. So with that,
Thank you, Ms. Jazakallah khair.
Jazakallah khair. Let's finish off with a dua. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. Assalamu alaikum, everyone. Thank you very much for coming. Jazakallah khair. Please do stay connected with us. Thank you so much.
Wa alaikum assalam.
Wa alaikum salam.
Wa alaikum salam.